Today we will be reviewing Paronychia drainage. A paronychia is an infection that occurs along the lateral nail fold. The infection is most often precipitated by minor trauma, such as nail biting, hangnails, or manicures. The most common organisms that are involved are staph, strep, and anaerobic organisms. The initial management of paronychia involves warm soaks, elevating the extremity, and systemic antibiotics. Antibiotics should be chosen that have anti-staph coverage as well as anaerobic coverage for nail biters, such as clindamycin or augmentin. However, once fluctuance develops, incision and drainage is indicated for definitive management. The first step to performing a paronychia drainage is to appropriately anesthetize the digit. We performed a digital block using 1% lidocaine that is demonstrated here. The skin is first cleaned with an alcohol pad. Then, using a 27 gauge needle, the web space is entered at a perpendicular angle and approximately 1 cc of lidocaine is injected into each web space. The needle is then inserted along the dorsal aspect of the distal digit and a ring of anesthetic is placed. Following appropriate anesthesia, a tourniquet can be placed. If a commercial finger tourniquet is not available, one can be made using either elastic wrap or material from a disposable glove. The distal fingertip is then prepped with betadine. Either chlorhexidine solution or betadine solution can be used for the sterile prep. Next, we laid out our sterile field. The area of fluctuance is incised with the scalpel in the longitudinal plane that is parallel to the lateral nail edge. You can see purulence is expressed as the incision is made. At this time, a wound culture could be obtained if desired. And then further expression of purulent material is performed with manual pressure in the surrounding area. In this video, a single incision is adequate to drain this simple paronychia. However, in cases where the infection extends below the nail, incision and elevation of the nail might also be necessary. The area is irrigated with sterile solution. The incision should be left open and a clean dressing should be applied. We chose to use a non-stick barrier followed by sterile tube gauze. This dressing can be removed approximately 48 hours, and the patient should then resume warm soaks. Follow-up for a recheck is generally recommended either with a primary care physician or a hand surgeon. Thank you for your attention to our video on paronychia drainage. We have demonstrated one technique that can be used. Please remember that there are other techniques possible which may be preferred depending on the location or size of the paronychia.